Mesqua is helping her family heal the best way she knows how. Jingle dancing outside of Regina General Hospital, where her kokum, her grandmother, is fighting against COVID-19.
It makes me want to break down every single day to knowing that how much of my family is getting sick.
First Nations communities across Canada are being disproportionately impacted by the virus. The latest numbers from the federal government reveal COVID cases on reserves are now more than 3 times that of the respective rate in the general population.
It can be devastating because there's severe overcrowding in many of these communities. Some of these communities don't have access to clean water. There's an overrepresentation of certain health factors that put them at risk, like diabetes.
Nahio family doctor James Mauracher also worries as hospitals in Alberta and Saskatchewan become overwhelmed, Indigenous people seeking care are being told to return to their communities.
There's very few, if any, health practitioners who can provide primary care, let alone acute care, in an Indigenous community.
And why he's focused on prevention, part of a project aiming to vaccinate 100% of the Indigenous population.
By taking the vaccine, it is asserting our treaty promise to health.
But without continued access to medication and services, as well as land-back discussions and a greater understanding of cultural-based care, Mauracher fears continued health inequity. Mesqua was initially told by hospital staff she needed special permission to dance here. Permission to be on land her ancestors have inhabited for generations.
It's just a wonderful feeling that you get knowing that your prayers are being answered, that your healing dances are working.
Standing her ground to proudly practice what's been passed down. Jamie Mauracher, Global News, Toronto.